All right, let's take a look at an example of an ABG interpretation. So in my previous video, we talked about normal ranges and established that the normal range for pH is 7.35 to 7.45. So this patient, their pH is low, meaning good, acidosis. Now looking at CO2, we said that the normal range was 35 to 45 millimeters of mercury. This patient's CO2 is elevated, so I'm going to draw an up arrow. Now this arrow trick is something that I learned when I was a nursing student. My professor told me that if the pH and the CO2 are in opposite directions, that tells you that more often than not, the cause is respiratory in nature. It's important to have all the pieces of the puzzle together before you draw that conclusion, but that's kind of a nice rule of thumb. So here we can start to think that this patient is experiencing a respiratory acidosis. But let's take a look at the bicarb and see what that tells us. So we said the normal range for bicarb is 22 to 26. 25 then would be within normal limits, meaning that the kidneys have not kicked in yet to compensate for that increase in CO2. So we can say that this is respiratory acidosis with no compensation. Stay tuned for more examples and leave me a comment if you have any specific questions or want to talk about something else nursing related.